Welcome to this guide. In this video, we will walk you through the complete outpatient workflow for a cash-paying patient undergoing a lab investigation. You will follow the patient's journey from registration to treatment while seeing how each department collaborates to ensure smooth, efficient care. The workflow begins at the patient registry, where demographic details are captured and a visit is created. Next, the patient proceeds to the billing desk to settle the consultation fee. Following this, the patient moves to triage, where vital signs are recorded and an initial medical assessment is performed to prepare for the doctor's evaluation. The patient then proceeds to the doctor's room for a thorough medical assessment. The doctor reviews the patient's information and triage findings, and if necessary, orders lab tests to support the diagnosis. Once lab tests are ordered, the patient returns to billing to make payment for the investigations. The patient then moves to the laboratory, where samples are collected and the requested tests are performed. Upon completion, the lab results are submitted to the doctor. The patient returns to the doctor for review of the lab results. Based on the findings, the doctor confirms the diagnosis and prescribes medication if required. Finally, the patient proceeds to billing to settle payment for the prescribed medication, followed by the pharmacy, where the medication is dispensed. This overview provides a clear understanding of how each step of the outpatient cash payer journey is coordinated, ensuring accurate billing, timely diagnostics, and seamless patient care. In the next chapter, we will explore how MediCenter V3 integrates seamlessly with this workflow, delivering the most efficient and patient-friendly experience in your hospital setting. When a patient arrives at the hospital, their first point of interaction is the reception desk, where a visit is created in MediCenter V3. The receptionist begins by searching for the patient using the system's search bar to determine whether the visit is a revisit or a new registration. Patients can be located using unique identifiers such as a patient ID, OPD number, or phone number. This step is essential to prevent duplicate patient records. If the patient already exists, the receptionist selects the patient from the populated list, reviews the demographic details, and updates the biodata if necessary. Once confirmed, a visit is created by queuing the patient to the next point of service, which in this workflow is billing for consultation fee collection. For first-time patients, the receptionist captures all demographic details, ensuring all mandatory fields are accurately recorded. Once that is done, the patient is saved into the system and queued to the next point of service. It is essential to capture the correct visit clinic, as this ensures patients are routed appropriately and allows the clinic to accurately track the number of patients seen. Finally, fill all the necessary fields as required and queue the patient to the next point of service. By the end of this guide, you should be able to properly search for a patient, update patient records as needed, register a patient in the system, capture the correct visit clinic, and queue patients to the next point of service. Disclaimer: always check for patients using unique identifiers such as OPD number, phone number, or ID number before registering, to prevent duplicate entries in the system. At the billing point, the cashier accesses the patient from the patient queue. In scenarios where the receptionist is also acting as the cashier, the process remains the same. The receptionist accesses the cashier queue panel by clicking the queue button located at the top right corner of the screen. On the queue window, the patient will not appear under the reception queue because they have already been queued to the billing point. To locate the patient, the cashier or receptionist clicks on All to view patients queued across all service locations. If the list is long, the search bar can be used to quickly narrow down and locate the patient. Once the patient is found, the user double-clicks the patient's name to open the patient's bill, which redirects them to the billing window. On the billing window, the patient details section is displayed at the top to help confirm that the correct patient has been selected for billing. Below this section, in the bill items area, the consultation fee is automatically billed. This happens because the consultation service is configured to be auto-billed when a patient is queued from reception to billing. This automation minimizes manual billing and helps prevent revenue leakage caused by missed charges. If auto-billing is not enabled by configuration choice, the cashier can manually bill the service. To do this, the cashier selects item type and chooses service from the drop-down list. In the service name field, the cashier searches for the consultation service by typing part of the service name and then selects it. Once selected, the system automatically populates the price based on the predefined configuration. Please note that editing of the prices is privileged control. The cashier then confirms that the sales quantity, amount, and net amount are correct. If the consultation service is performed by a specialist, the cashier selects the appropriate consultant from the consultant drop-down and links the consultant to the service. This linkage enables accurate tracking of services performed by each consultant and supports end-of-day reporting, consultant payment calculations, hospital deductions, and withholding tax processing. After confirming all details, the cashier clicks the plus button to save the manually added service. It is important to note that this manual billing process applies only when auto-billing is not enabled. Additionally, services that are auto-billed are not automatically linked to a consultant. If a consultant needs to be associated with an auto-billed service, the cashier selects the auto-billed service from the bill items list, chooses the consultant from the drop-down, and clicks the update button to save the changes. After confirming the billed service, the cashier proceeds to receive payment. The cashier selects the service to be paid for, chooses the type of sale, selects the payment mode, and enters the amount tendered. The cashier then clicks Save Payment to generate the receipt. It is important to print the receipt and issue it to the patient as proof of payment. Finally, click on the Actions tab and queue the patient to the next point of service, which in this case is triage for vital speaking. By the end of this learning path, you should be able to access the billing window from the patient queue, locate the auto-billed consultation fee, manually bill a consultation service when auto-billing is not configured, link a service to a consultant, save payment for the consultation fee, queue the patient to the next point of service. Disclaimer: please note that editing of prices is privilege controlled. The triage nurse should first ensure they are signed into the correct room in order to view patients queued to that room. If the nurse is currently operating from another room, for example, reception, they must first sign out of that room. To do this, click on the current room, e.g., reception, or whichever room you are operating from. On the pop-up window, click Sign Out. After signing out, click the Select Room drop-down, choose the preferred room to operate from, in this case triage, then click Sign In. To access patients queued to the triage room, the nurse can either click on Clinical and select Triage from the menu list, or use the Triage shortcut on the home page. Both approaches lead to the same result. Please note that access to the triage panel is privilege controlled. Within the triage panel, the nurse will see all patients queued to their room in the patient mini queue, including the patient's OPD number, name, the room they were referred from, and the time spent waiting in the queue. If the queue is long, the search bar can be used to quickly locate a specific patient. To select a patient, either double-click the patient's name or click once. The patient's demographic details will then be displayed in the patient details section. Under General Examination, the nurse can record vitals. Click on the Vitals drop-down, select the appropriate vital based on the intervention, enter the remark, and click Add. If the recorded value falls outside the normal range, it will be color-coded in red, values within the normal range will appear in black. If an examination was recorded incorrectly, click the delete button and confirm by selecting OK on the prompt that appears. If a procedure was performed to stabilize the patient, for example, administering an injection, click on the procedure drop-down, use the search bar to locate the performed procedure, select it, and click Add to save. For systematic examination, if conducted, use the body system field to record the examination and enter the remark. If the findings are abnormal, check the Is Anomalous checkbox and click Add to save. The nursing notes section can be used to record any additional notes based on the nurse's intervention. Remember to click Save to ensure the notes are recorded. In the patient's previous visits panel, the nurse can view the patient's visit history and export it in Excel or CSV format, or print it directly using the Print button as needed. Under the Actions button, the nurse can perform several additional tasks, including requesting laboratory tests, radiology investigations, or theater services, prescribing medication, and viewing the visit summary and laboratory reports. The specific actions available will largely depend on the facility's operational workflow. All actions within this section are privilege controlled. Finally, click Queue Patient to send the patient to the next point of service, which is typically the consultation room for the doctor's initial assessment. By the end of this learning path, you should be able to sign out of one room and sign into another. Use the triage panel effectively. Queue a patient to the next service point. Disclaimer: the triaging workflow is privilege controlled and largely depends on your facility's operational workflow. The key requirement is understanding how the triage panel operates and how to navigate its features effectively. The clinician should first ensure that they are signed into the consultation room from which they are operating in order to see the patients queued in the doctor's queue. Then, navigate to the clinical module and select the doctor's panel. Alternatively, they can use the shortcut on the home page. Both approaches will lead to the same panel, as shown. Within the doctor's panel, the doctor will see all patients queued to their room in the patient mini queue, including the patient's ticket number, OPD number, patient name, the room they were referred from, and the time spent waiting in the queue. If the queue is long, the search bar can be used to quickly locate a specific patient. To select a patient, either double-click the patient's name or click once. The patient's demographic details will then be displayed in the patient details section. In the doctor's panel section, the doctor will see the patient's vitals as recorded by the nurse during triage. For additional notes on what transpired in triage, the clinician can navigate to the Actions tab and select Visit Summary from the menu list. Here, they will be able to observe the recorded vitals, the systematic examination conducted, any procedures performed, along with nursing notes and requested lab investigations, if any, for better patient care and decision-making. Please note that this report can be downloaded in various formats, printed directly from the browser, or shared via email based on your needs. Past visit summaries are found in the patient's previous visit section, along with the date of each visit. You can select any report to review what occurred during a previous visit, helping guide your clinical decision-making as needed. Clark the patient details in the provided fields. After filling each field, ensure you press the blue plus button to save. Enter patient's complaint. This section allows the doctor to capture the patient's subjective description of symptoms, discomfort, or condition. Click the Add button to save each complaint. Enter history of presenting illness. This is a detailed narrative about the progression of the patient's current condition or illness, including onset, duration, severity, and any associated factors. Enter medical history. Here, the doctor enters details about the patient's past medical conditions, chronic illnesses, hospitalizations, or any other significant health issues. This helps in understanding the patient's overall health. Enter surgical history. Record any previous surgeries or procedures the patient has undergone. This is crucial for avoiding complications with current treatments or prescriptions. Enter family history. This section collects information about any hereditary or genetic conditions in the patient's family. It's essential for understanding potential risk factors for diseases such as diabetes, heart disease, or cancer. Enter social history. This involves gathering information about the patient's lifestyle, including smoking, alcohol use, occupation, and exercise habits, which may influence their health. Enter economic history. This section may capture information about the patient's socioeconomic background, including employment status, insurance coverage, and financial capacity for healthcare, which can affect treatment options. Record any known allergies the patient has, especially to medications, food, or environmental factors. This is critical to avoid any adverse reactions during treatment. Enter your impression. This allows the doctor to note initial clinical impressions based on the patient's symptoms, examination, and history. It could also include working diagnoses. You can have more than one impression. Ensure to click the Add button to save. Finally, click on the Actions tab and select Lab Request from the menu list. In the pop-up window, click on the Lab Test drop-down. In this case, since we suspect malaria, we will request a BS for malaria. You may record history as needed, then click the Add button to save. You can add more than one test based on your intervention. In case you added a test by mistake, you can easily delete the test request by clicking the Delete button and confirming by selecting OK on the prompt that appears. Close the window, and from the Actions tab, select Queue Patient to queue the patient to the next point of service, which is billing, to go and pay for the requested lab tests. By the end of this learning path, you should be able to sign into the consultation room and access the patient queue. Navigate the doctor's panel and find patients. Review patient demographics, vitals, triage notes, and visit summaries. Record patient information. Request and manage lab tests. Queue patients to the next service point while maintaining accurate records. Disclaimer: the doctor's panel is privilege controlled and largely depends on your facility's operational workflow. The key requirement is understanding how the panel operates and how to navigate its features effectively. The billing officer or cashier operates from the billing office, which serves as their assigned service point. Once patients are queued to the billing office, they can be accessed from the queue panel. At the bottom left of the queue panel, the My Room option displays patients queued specifically to the billing office, while the All option shows patients queued across all service points within the facility. To bill a patient, the cashier may use the search bar to quickly locate the patient if the list is long. Once the patient is identified, the cashier either double-clicks the patient's name or clicks once as shown to open the billing window. The system then redirects the user to the billing window. Within the billing window, the cashier scrolls down to the bill items section to review the listed charges. In this scenario, the bill includes laboratory tests requested by the doctor, which should be paid for before the patient proceeds to the laboratory. Additionally, an injection performed at triage by the nurse is also listed as a billable procedure. These items are auto-billed by the system to ensure that all services rendered are captured and to seal revenue leakage. The cashier selects the relevant bill items as shown, then proceeds to the type of sale drop-down to choose the appropriate sale type. Next, the cashier selects the payment mode, enters the amount tendered in the provided field, and clicks the Save button to complete the transaction. Upon saving, the system generates a receipt. It is important to print the receipt and issue it to the patient as proof of payment. Finally, the cashier clicks on the Actions tab and queues the patient to the next point of service, which in this workflow is the laboratory, where the tests will be conducted. By the end of this learning path, you should be able to access patients from the billing queue panel, identify auto-billed laboratory tests and procedures, receive and process payment for laboratory services and performed procedures, generate and issue a payment receipt, queue the patient to the laboratory for test execution. Disclaimer: please note that editing of prices is privilege controlled. The laboratory technician should first ensure that they are signed in their room in order to see patients queued to their room. Then navigate to the clinical module and select the laboratory panel. You can as well use the shortcut available on your homepage. Both approaches will lead you to the same panel. The mini queue indicates the patient's ticket number, OPD number, patient's name, the room from which the patient is coming, and the total time spent on the queue. If the queue is long, the search bar can be used to quickly narrow down to a specific patient. To select a patient, either double-click the patient's name or click once. The patient's demographic details will then be displayed in the Patient Details section. On the Requested Tests and Results section, you can add a test to the patient by clicking the Lab Test drop-down. On the populated list, you may use the search bar to narrow down to the lab test, then select and click on the plus button to save, but note that under this case, the patient will have to pay first for the test to appear under the requested tests since a patient is a cash payer. Ensuring that all services are paid upfront before any action is taken. Also note that this configuration can be disabled to allow unpaid services to still appear in the lab once requested, either paid or unpaid. However, you may end up losing revenue due to missed charges. To proceed, select the test and click the Sample Collection button. In the subsequent window, the specimen is going to auto-populate automatically based on the lab test configuration. However, there is still a room to change just if the test was mapped to wrong specimen. To do so, under the sample collection, click on the specimen drop-down and select the appropriate specimen if configured wrongly. Enter the date and time collected as well as the date and time received for the sample. Fill in the expected turnaround and specify if the time is in minutes, hours, or days. Enter the specimen condition and the tag, which is the identification tag used to track and manage specimens. Then, click on the Save button to save. Once the sample collection is finalized and the results are returned, fill in the values in their respective fields. The anomalous checkbox will automatically check itself if the test is anomalous for any of its components. As the results are filled, the system will automatically save the lab results. If you have more information that you would like to add pertaining to a particular test, click on the test conclusion to add your notes. It is also important to approve the results to ensure that the test results meet the required standards of accuracy and precision. To approve the lab results, click on the Actions button and select Approve Lab Results and confirm by selecting OK. Other actions that you could also perform on the Actions menu may include viewing requests, viewing previous visits, queuing patients to another room, upload digital or scanned files particularly to enhance diagnostic accuracy and supporting patient care, viewing lab request slip, viewing the patient's visit summary, viewing the lab report or lab report, test per page, as well as unlocking lab requests, which is often used when new data or insights emerge and the test had already been marked as approved. In some scenarios, a test may have a long turnaround time and not be completed in time, and yet the doctor wants to view the lab report urgently. In such cases, ensure you tick the checkbox is partially done so as to fill the lab results later when they are ready. Once the lab results are filled and finalized, click on the Submit Lab Report button to submit the results. Once submitted, the results are available to the requesting doctor. Submitting a lab report will automatically mark the test as done and remove it from the pending category. In the subsequent window, click on the To field and select the room where you want to queue the patient. In this context, it's the consultation for a second assessment to determine the better care for the patient based on the findings. By the end of this learning path, you should be able to sign into the correct laboratory room to access queued patients. Navigate to the clinical module and open the laboratory panel. Search for and select a patient from the mini queue. Add laboratory tests to a patient's request. Understand the impact of payment configuration on test visibility. Perform and document sample collection correctly. Modify specimen details when necessary. Enter turnaround time and specimen condition details accurately. Record laboratory results and interpret anomalous flags. Approve laboratory results following validation. Submit laboratory reports to the requesting doctor. Queue patients back to consultation after report submission. Once the patient has been requeued to the doctor may then proceed to review the laboratory report. Reviewing the laboratory report allows the doctor to assess clinical findings, confirm or rule out potential conditions, and make an accurate diagnosis. It also supports informed treatment decisions, including appropriate prescriptions and follow-up care. To access the patient lab report, follow the following steps. Select the patient from the patient menu, then navigate to the Actions tab and from the menu list select the lab report. The report is going to appear as shown. From this view, the doctor can review detailed findings, interpret the results in relation to the patient's condition, and use the information to support diagnosis, treatment planning, and prescription decisions. The report clearly indicates the presence of Plasmodium falciparum, confirming that the patient has a malaria infection. From here, the doctor will proceed to diagnose the patient. To do so, close the current window as shown. Then navigate to the diagnosis field and record the appropriate diagnosis by selecting the relevant code from the ICD-10, ICD-10-CM, or ICD-11 classification system, in accordance with your system configuration. Then click on the plus button to save. Please note that you may add more than one diagnosis based on your need. At this stage, the clinician may proceed to make a prescription. To do this, click on the Actions tab and select Prescription from the available menu options. On the next window, if the prescribed medication is available in stock, begin by selecting the appropriate storage location from which the drug will be dispensed. For example, pharmacy. Next, select the medication from the inscription, item name list. This ensures the correct drug is chosen from the inventory database. The prescription refill management section is particularly useful for chronic patients who require long-term, continuous medication, such as those being treated for hypertension, diabetes, or asthma. When prescribing a refill, enter the number of refills permitted and specify the refill interval in days. This determines how many times the medication may be refilled and the minimum time that must pass between refills, without requiring a new consultation. In our case, we are not dealing with a refill prescription. We will proceed to enter the quantity per time, which represents the amount of medication the patient should take at each dose. The dosage unit will automatically populate based on how the item was registered in the inventory system. Input the frequency per day, indicating how many times the medication should be taken daily. Specify the duration of treatment and select the appropriate period either in days or weeks to match the prescribed timeframe. The system will automatically calculate the total quantity required based on the dosage, frequency, and duration entered. However, this value may be adjusted manually if necessary. The dosage instruction field will auto-generate standard instructions based on the prescription details, but it can be edited to suit specific clinical requirements. Use the Prescription, Special Instructions section to include any additional guidance for the patient beyond the standard dosage directions. For example, take after meals. Then click on the Add button to save the prescription. Please note that you may add more using the same process. To edit an existing prescription, right-click on the item and select it. Make the necessary changes and click Update to save the modifications. Within the prescription window, you may select View Non-Stock Report to generate a report for non-stock items, or click View Report to generate a stock prescription report. Once all prescriptions have been added or updated, close the window. Then click on the Actions tab and select Queue Patient to send the patient to the next point of service, which is the billing office, where payment for the prescribed drugs will be processed. After payment is completed, the patient will be redirected to the pharmacy for medication dispensing. By the end of this learning path, you should be able to access and review a patient's laboratory report, interpret laboratory findings to support diagnosis, record diagnosis using ICD-10, ICD-10-CM, or ICD-11 codes, add multiple diagnoses where clinically necessary, create and manage prescriptions, manage prescription refills for chronic medications, enter dosage, frequency, and duration accurately, edit and update prescriptions when required, generate prescription and non-stock reports, queue patients to billing after prescription completion. The cashier will then access the patient from the main queue in the billing office. Then double-click on the patient's name to access the billing window. They will be redirected to the subsequent window as shown. To bill the prescription items, the cashier will scroll down to the Bill Items area, then select Prescribed Items from the list of charges. The amount to be paid will be indicated as shown here. The cashier then proceeds to receive payment, chooses the type of sale, selects the payment mode, and enters the amount tendered. The cashier then clicks Save Payment to generate the receipt. It is important to print the receipt and issue it to the patient as proof of payment. Finally, click on the Actions tab and queue the patient to the next point of service, which in this case is the pharmacy, to pick up the medication. By the end of this learning path, you should be able to access a patient from the billing queue, navigate to the billing window, bill prescribed medication correctly, receive and record payment using the correct payment mode, generate and print a receipt, queue the patient to pharmacy after successful payment. To view patients who have been queued to the pharmacy room, first ensure that you are signed into the pharmacy room. Confirm that you are actively working within the pharmacy panel, as shown here. Once you are in the correct room and panel, navigate to the queue list section. This will display all patients who have been directed to the pharmacy for medication pickup. Here, you may use the search bar to quickly find a patient if your list is long. Click on the patient's name as shown. Their demographic details will be displayed in the Patient Details section area. This is to confirm that the correct patient has been selected for the medication to be issued. Please note that medications which have not been paid for will be color-coded in red and will be inactive. The system cannot allow you to select and dispense them. The patient must pay for them first before they are dispensed. Paid medications will be color-coded in black, indicating that the pharmacist may proceed to dispense them. This approach ensures that no pharmacist can dispense unpaid medication, helping to seal revenue leakages. To proceed, select the drugs to be dispensed. The pharmacist can either use the instructions provided to verify the prescribed medications and proceed with dispensing accordingly, or click on the Actions tab and, from the menu list, select Prescription Report. They will be redirected to the Prescription Report window. Review drugs and the batch information carefully to ensure that the correct stock is selected and that expiry dates are within acceptable limits. Once verification is complete, close the current window and proceed with dispensing. Mark as dispensed indicates that the patient visit has not ended due to certain reasons. For instance, the patient might be waiting to be admitted, among other reasons. Dispense and finalize indicates that the patient visit has come to an end and the patient is picking up medication to go home. This action finalizes the patient visit and removes them from the queue. Click on Dispense and Finalize and confirm by selecting OK to end the patient's visit. By the end of this learning path, you should be able to sign into the pharmacy room and access the pharmacy panel. Locate patients in the pharmacy queue. Differentiate between paid and unpaid medications. Review prescription details and batch information. Verify drug expiry dates before dispensing. Dispense medication correctly. Use mark as dispensed when the visit is ongoing. Use dispense and finalize to complete the patient visit. Finalize and remove the patient from the pharmacy queue.